Hi, I'm Christina, a nurse at Lurie Children's, and I'm going to help you prepare for your child's procedure. Having a procedure at Lurie Children's means your child will be cared for by some of the most skilled and experienced medical professionals in the world. These experts work together to guide your child safely and smoothly through procedures and recovery. Your child's procedure may be done at Lurie Children's Main Hospital in Chicago, Lurie Children's Outpatient Center in Westchester, or Lurie Children's Surgery Center in Northbrook. You can expect the same quality and expertise of care at each location. Your surgeon's or physician's office will schedule your child's procedure days or months ahead of time. You can expect a call from the pre-screening nurse at the hospital who will verify your child's information and current health conditions. Your child may need testing or checkup completed before undergoing a procedure. The representative from your surgeon or physician's office will make sure you know if this is the case and can help you schedule it. About a week before your child's procedure, a patient registration liaison may call you to pre-register your child. This person will ask you for information such as your mailing address, age of your child, and insurance coverage. You may also receive a separate call from a financial counselor to discuss your child's benefits and/or payment options prior to the visit. On the afternoon of the day prior to your child's procedure, you will get a call from the pre-screening nurse to tell you what time to arrive for the procedure. This nurse will also provide important feeding instructions for your child and can address any questions you may have about medication your child takes. It is very important for your child's safety to follow the feeding instructions. Your child's procedure could be delayed if feeding instructions are not followed, as it is unsafe to perform a procedure under anesthesia if the patient does not have an empty stomach. On the day of your child's procedure, check in at the reception desk. A staff member or nurse will direct you on where to go from there. Once in a preoperative room, your child will be checked in and given an ID bracelet and a hospital gown. A nurse will perform a complete assessment, checking your child's temperature, blood pressure, heart rate, and breathing. A specially trained pediatric anesthesiologist will discuss with you the plan of care, which may include a sedating pre-medication followed by anesthesia medicine. You will also meet with your surgeon, proceduralist, or a member of the team who will discuss the procedure and answer any questions you have. Your family may also meet with a child life specialist. Child life specialists are trained professionals who help children and their families understand and feel comfortable in the hospital. You may stay by your child's side until they are taken to the operating room. During the procedure, you will stay in a waiting room or a preoperative room or inpatient room assigned to you. We will make every attempt to keep you updated during the procedure. Once your child's procedure is complete, your child's doctor or nurse will update you. When the procedure is complete, your child will stay in the operating room while they wake up from anesthesia. After waking, your child will be taken to a recovery room, where a nurse will closely monitor your child's physical condition. You will be called from your waiting room when you are able to visit your child in the post-anesthesia care unit, or PACU. They may be irritable or disoriented due to anesthesia. This is a normal response. After your child is ready to leave the recovery room, they will be moved to an extended recovery area or an inpatient bed. Following their procedure, your child may experience pain. We will do everything we can to make your child as comfortable as possible. If your child must stay overnight at the hospital following a procedure, one adult from their family may stay with them in the room. Each inpatient room has a chair that pulls out into a bed. When your child is ready to safely go home, hospital staff and providers will work together to discharge you from the hospital. We will be sure you have a phone number to call with any questions you have about your child's condition once you are home. At this time, you may receive special instructions for your child's diet, wound care, medications, pain management, or other needed follow-up care. The day after your child's procedure, a nurse will call to follow up and answer any questions you have. As one of the country's best children's hospitals, Lurie Children's staff and healthcare providers work together with you to ensure your child gets the best possible care. Please speak up about any aspect of your child's care and tell us anything you feel is important. If your child's needs were not addressed in this video, be sure to ask your surgeon or physician's office about your concerns. We have the resources to meet every child's individual needs. At Lurie Children's, we put children and their families at the center of all we do, and we look forward to caring for your child.